dear audience, allow me to introduce you to my PhD topic, which is the management of breast cancer surgery complications. I'm Levente Doleviczényi. I'm a general surgical resident and a first-year PhD student. My supervisor is Zoltán Klárik, and my SMS is Lőrinc Frivalczky. Our vision is an improved post-operative quality of life in women with breast cancer. And in order to achieve this, our mission is to assess the different available surgical techniques and strategies in breast cancer. We have two different projects ongoing, both of which have started in the autumn of 2024. We will start with the first one, which is investigating the efficacy and safety of steroids in the prevention of seroma formation after mastectomies. Breast cancer is the most common cancer in women, with over 2 million new cases diagnosed worldwide in 2022 alone. Surgery is still a main pillar of the multidisciplinary treatment. After mastectomies, one of the most common complications is seroma formation. It can occur in cases up to 85%. You can ask yourself the question, what is a seroma? Well, it is a collection of inflammatory fluid in the operative area. And why is it bad? It can lead to repeated aspirations. It poses a risk of infection up to 15%. And it can even cause a delayment of oncology treatment. Thus, dealing with seromas is critical for optimal patient care. There were many strategies used and tried to reduce seroma formation after mastectomies, such as creating sutures, fibrin glues, but in this project, we will focus on the use of glucocorticoids as the prevention method. Our aim is to determine whether using perioperative steroids are beneficial for our patients. So our clinical question is that in patients undergoing mastectomies, does glucocorticoid use decrease the development rate of seromas compared to no drug use? Our population is patients undergoing mastectomies. Intervention is the glucocorticoid use, such as methylprednisolone or hydrocortisone, and the comparator is either a placebo or blank control. The outcomes, most importantly, are seroma formation and infection rates, and other secondary outcomes such as total drainage volume and the duration of drainage. Our hypothesis is that perioperative glucocorticoids are beneficial for our patients and decrease the rate of complications. The clinical implication is that we want to contribute to new guidelines regarding the perioperative care of patients undergoing mastectomies. Here we have 3 key articles. This group focuses on post-operative local methylprednisolone use, and heterogeneity is quite low in this group, and all of these researchers have provided reduced seroma development in the intervention groups. We have our final search key here. The first domain stands for the population, so patients undergoing mastectomies. The second domain is for the different types of glucocorticoids. We have conducted our systematic search in 5 different databases. You can see the number of hits below. After the search, we had over 7,000 articles. After the duplicate removal, we went below 4,000. And after the title abstract selection, with my selection pair Dóra Fedorcsák, with a Cohen's kappa of 0.85, we had just over 60 articles. As you can see on the first project progress, now we are at the stage or at the end of the full text selection. We are proceeding well, and then we will continue to data extraction. The second project is comparing the efficacy and safety of different techniques in reducing donor site morbidity after latissimus dorsi muscle harvest. So breast cancer is the most common cancer in women, with over 2 million new cases diagnosed worldwide in 2022. After mastectomies, patients can opt for reconstructions, either with implants or autologous reconstruction. And one of the most common ways for this is with the either immediate or delayed reconstruction with the latissimus dorsi flap, so the big muscle from the back brought to the front for volume replacement. Unfortunately, after these surgeries, donor site morbidity can be quite severe, such as shoulder movement disorders or seroma formation. This can occur in up to 79% of the cases. It can lead to patient discomfort, it can lead to wound complications, or even a danger of the skin flap necrosis. The strategies used to reduce these morbidities are creating sutures, fibrin sealants, and glucocorticoids. Our aim is to find the best technique or a combination of these techniques that reduces donor site morbidity. So our clinical question is, which technique reduces donor site morbidity the most in patients undergoing latissimus dorsi muscle harvest? The population is patients undergoing latissimus dorsi harvest. You can see the different kinds of interventions, such as creating sutures, fibrin glues, or perioperative triamcinolone or glucocorticoid use. And we have one combination, which is creating sutures and fibrin glue. Comparator is either placebo or blind control. And the outcome is seroma development, wound complications, and if we have enough data, then shoulder disorder rates and others. Our hypothesis is that there is a difference in efficacy, and the combination of the techniques can be synergistic. The clinical implication is that we want to contribute to new guidelines regarding the latissimus dorsi muscle harvest. We did our preliminary research and found one meta-analysis on this topic, but it's almost 10 years old, and we will add more data, more articles, and even a new possible intervention method. There is no current prospective registration on this topic. Here we have the key articles, which are pretty similar. This group focuses on the use of creating sutures, and the researchers have found reduced seroma development in the intervention groups. Here we have the preliminary search key. First domain focuses on the latissimus dorsi muscle harvest population, and the second domain is for different kinds of techniques. The preliminary searches were done in 3 databases, and you can see the results below. Now we're at the stage of the feasibility check. After that, we will go on to register our Prospero. So in summary, we have 2 ongoing projects. First, with the mastectomy patients and the reduction of seroma development, and the second project is for the latissimus dorsi muscle harvest and reducing donor site morbidity with different techniques. We plan to finish these projects in 2025. I would like to conclude my presentation with a quote from Oscar Wilde: "I can resist anything except temptation." Thank you for your attention.
Thank you, Levente, for this great presentation.
I would like to ask that, is there any kind of possibility to detect or measure this seroma? How do you do that? How do you identify if somebody has a seroma?
We identify, so it can be different kinds of diagnosis. The most common one is the clinical diagnosis. So when the patient feels discomfort, with hand you can palpate that there is some fluid there, and then ultrasound, so radiologist can even confirm it, but most of the time a clinical, like a physical examination is enough. And after aspirating it, you can measure the volume.
Thank you for your brilliant presentation. I would like to ask if there is a subpopulation of these mastectomy patients in which you would not use glucocorticoids in clinical practice.
Yes, thank you. So generally, glucocorticoids are quite safe to use, but sometimes you have to have caution. For example, in patients taking immunosuppressant drugs, such as patients after transplantation, or patients with autoimmune diseases. So sometimes you cannot, or diabetes mellitus, so sometimes you cannot do this, but most of the time it's safe.
Great presentation, great progress. For the second project, you're investigating quilting sutures and fibrin glue and triamcinolone use, right? But
yes.
You are not planning to investigate the triamcinolone use with quilting sutures and fibrin glue. Why?
Yeah, good question. It would be a good combination. We would love to examine that as well. But based on the preliminary researches, there is no combination the literature has viewed. So, but if we found it, then of course we will include it.
Thank you.
Congratulations. I would like to ask that would you examine the dosage of the glucocorticoids?
Sorry, please again?
The dosage of the glucocorticoids. Will you examine? Because different dosage has been different effect.
Yes, the dosages are quite similar, so they are almost always 120 or 125 methylprednisolone, and it's always 100 milligrams of hydrocortisone, so they are quite similar. In one study, they are doubling the amount of hydrocortisone, so 2 times 100 milligrams of hydrocortisone. Yeah, but it still is pretty similar.
And what about the wound healing? Because if you gave glucocorticoids topically, it can cause that the wound healing would be not so good.
Yeah, that's why it's one of our outcomes is wound infection and other wound complications. So indeed it's very important for the safety of using this method. So we're eager to see what the results show.
Thank you.
Congratulations, it is also very interesting. So my question is, so do you use the methylprednisolone in the primer surgery or after to reduce the recurrence of the seroma? So when you do the mastectomy and you use the prednisolone at this phase, or post-operative period when there is a seroma, you do the punction and you use in this phase? Or
yeah, so it's a prevention method. So we either use it before the surgery as intravenously or after the surgery topically, so inside into the wound. But both of these are prevention methods, so there is no seroma yet. We want to prevent that.
Thank you.